Good, good afternoon. And today we have an honor to interview two my favorite people, Dr. Katy Kennedy and Nikki Robertson. Katy, she was on our program before. She is a doctor, pathologist, and she invent beauty balloon, the tool to do myofunctional or facial exercise. And Nikki, she's an esthetician, and she has a long path she got from traditional cosmetology work to help her followers and people who use her service to learn about natural way to keep the beauty. And look at her, she's glowing. I'm not asking about your age, but I follow the routine you do on Instagram, so I see how it's working. And so again, good afternoon, Nikki.
Good afternoon.
And good afternoon, Dr. Kennedy.
Hi, Maria. Thank you so much for having us. This is so fun to do.
And I'm going to start with a story about the people I brought to the studio today. Katy, I met on a MyoCon conference, and I quickly was impressed with the reinvention she did from working, as a standard medical pathologist and learning about us from inside, I would say, about human anatomy and the disease we're facing in this time and age of our development, to invention of this beauty balloon series for boys, for girls, a series of exercise what can help us develop a better muscle base and help with swallowing, help with airway development. And then through Katy, I learned about Nikki. And Nikki, just like I mentioned before, she's a holistic esthetician for 31 years. And I want to reinforce the word holistic. So she certified in manual lymphatic drainage, vitality sculpturing, I guess with the exercise and massage, fascia release, red light therapy, all of these topics what we discuss on our channel with the, on a different program. And she is owner of Facet Salon, what offer holistic aesthetic services, and she is a very successful content creator on Instagram and TikTok, and you can check for yourself because we're gonna have a links underneath the interview, and you can follow her social media channels. And again, thank you very much to our audience. If you have trouble sleeping or sleep next to the snoring partner, I'm sure you're gonna get some practical tools out of this interview. And if you're a medical professional who, just like us, so passionate about helping your patients sleep better and feel better, I hope you learn some strategies as well. So these together, we can put puzzles of this disease and find the solutions for our patients.
Yes,
so
absolutely.
I'm going to start and we're going to talk about exercise and nutrition, like a whole holistic approach to care. So I'm going to start with Nikki. You spent years as a makeup artist and esthetician, and what made you explore facial exercise? Because I'm sure with your tool you can create illusion of beauty. What made you this turn and do what you do right now, and how it complements traditional beauty treatment?
Yes. So I always began with an interest in a natural approach to skin. That's always been the focus. And so when I first started, it was trying to introduce to people healthy ways to take care of their skin. But as I worked on people's skin more and more and started taking an intake of all of their habits, their lifestyle, I started to realize connections between things that were showing up on the surface of the skin and things that were going on in the body or in their lifestyle or, in their mental state. And so that encouraged me to dive deeper and to get additional training, certifications, and understanding in how to help them beyond just the surface of the skin. Because if you get to the root cause, then you can change things permanently, as opposed to you got to come back every month to make something, to have me work on it. So that was my goal. I was looking more for root cause things.
That's a beautiful answer. But now I want to ask Dr. Kennedy, you have a background in pathology, and, what giving you kind of a look from inside on aging. So what most overlooked factor, what contribute to facial aging? I really like, Nikki, what you said about the faces. I'm going to be a little bit longer with my question, because as a health practitioner who constantly look at the people's face, I notice what this is a mirror. This is totally a mirror. And this is a mirror. This is a mirror. This is a mirror. And, I post a lot of videos. I came from Ethiopia, and I noticed they have a totally different mirror. It's totally different faces, and how they age. It's very different how we age. So going back to you, Dr. Kennedy, please, with that question, your unique perspective, what's most overlooked factor, and can you demonstrate easy at-home technique to strengthen facial muscles? Because we all know with aging, muscles get weaker, and you reflect a lot of wonderful things in your book and, your tools. So give us your view, and at the same time, maybe you can show at-home technique to strengthen facial muscles to prevent anti-aging.
And if you want to describe it, I will demonstrate it for you, because we always do that on my channel.
Sure.
Absolutely. We're all going to demonstrate.
Yeah. So from a pathologist standpoint, it's very interesting, because my life has been spent at the microscope, looking at tissue, looking at every layer of tissue. So going through the layers, we start with bone, muscle, fat, which we call adipose tissue, and skin. And then, of course, with skin, there's two parts to the skin, epidermis and dermis. And so much in aesthetic medicine, we focus on the skin layer, right? We've got that down. We've got the epidermis down and the dermis down, and we know what to do with that. But what about bone? What about muscle? And those are the two tissue layers, Maria, that really drew me into this world in terms of health, aesthetics above the clavicle. What can we do other than skin? We've got, our dermatologists are amazing at that. Our plastic surgeons are amazing at it. What are we going to do about the muscle? And that's a layer that's left out. We pay so much attention to muscle below the clavicle.
Yes.
I want to bring attention to muscle above the clavicle and keeping us healthy, strong, tone in the head and neck region. So all of these wonderful muscles. So resistance training is what I have brought into this realm, is resistance using simple tools. It was my own personal health journey that led me to create the tools. I'm a horrible allergy sufferer. In my youth, I had retraction orthodontics back in the late 70s, early 80s. And that's, of course, what we did back then. So when you have that combination, we know what that's a setup for. Mouth breathing and struggles with nasal breathing, a lifetime of it. Then when you hit perimenopause, menopause, and now estrogen drops, as we know with women catch up to men in terms of snoring. When we reach menopause, now everything's going awry. And so your health can really go awry during this phase. So I started doing these exercises because I knew if I can strengthen my tongue, if I can get my lip seal strength strong, I'm going to turn my health. I'm going to do it myself, all naturally, just like what Nikki mentioned. The body has an amazing ability to heal itself if you know what to do. And so that's where people like us come in, right? With our knowledge and our background, and bringing each perspective together to help people become more healthy, live a higher quality of life, improve their well-being. And that's really in the end what it's all about. And so this is what I created. And so just some, if you wanted to, we can show a couple of
Yes,
general.
I really would like, yes.
Sure,
Yeah.
we'll start. We can do the tongue two-step. This is a wonderful exercise to strengthen the tongue. And the concept is you open, this is called the butterfly tool, and you put the tongue through one hole, pulling the tool opposite to the direction of the tongue. So it's against resistance training. So it's a lateralization in this plane to exercise the tongue. And about the third rep, I really start to feel that in here when I start to do that. And really,
Yes.
and you can hold for 5 seconds. Huh? And so that exercise is amazing. And then also in that same plane, you can keep the tool open and you can do push pull. So anterior, posterior. So push pull. Push with your tongue, skinny tongue along the attachment site and pull back with the tool. And so again, that's resistance training. And so again, you can hold for 5 seconds for isometric or isotonic, doing the repetitions back and forth. And you can also extend the head back just a little bit to help engage the muscles a little bit more. Even though we may look funny, this is such a wonderful thing to do for preventative measures. Being in the hospital setting, I used to get specimens all the time, rule out aspiration, and from our pulmonologist because they're worried about folks with weak tongue, having a poor swallow pattern, and you can aspirate fluid, saliva, food into the lung. And once you're at risk for aspiration, that really, really sets you up for a challenge. So these are wonderful, simple things that we can do. So we don't have any of those issues. Let's prevent those issues. And so working in groups like this really help to do that.
Another one that I really love is where we bring the tongue back and forth. But like that's key for jaw health. So I'm going to do that.
Yes. So you put the two fingers, put the base right at the mental crease, just under your lower lip there. Then grab the opposite base with your tongue. And I call the tongue wag. So you just kind of wag your tongue back and forth.
Yeah. So it's like this. Only it's creating resistance with the tool.
And you don't move your jaw. So there's no compensation. It's strictly isolating the tongue back and forth, back and forth.
This is wonderful because it really feels right here. And for people who don't want to have a second chin, double chin is not fun. Yeah.
Right.
That's great.
I have a question. Thank you very much, Kathy. It was a great idea. And Nikki, can you show us simple face exercise what can pair well with the skincare routine? You know, like people apply the creams. It's both for male and females. And while they're doing that, what the face exercise?
So a lot of the exercises that I do focus on the neck, both front and back, and then the forehead. Because when you have forward head posture, forward shoulder posture, this creates fascial tightness, muscle tightness in different places of the face. And so I like to work. So we have to go deeper than just worrying about the skincare because yes, we can do light. That's lovely. But I feel like people have a limited amount of time with which to work on their face. So if we're going to work on the face, we need to put the time in where it's really going to make a difference. So you'll put your skincare on. And then we have to start at the base of the neck. We have to start at the chest, actually, because with forward shoulder posture, this drags everything down. It can drag down. It can cause nasolabial folds because this is pulling. So we start first with pinching on the chest and bringing this up and then releasing at the clavicle. So Dr. Katie was talking about muscles and going beneath the surface. We have to address fascia because the fascia is like a spider web that holds your muscles to the bone. And if you have been having improper posture, if you've been having improper repetitive motions, this is what you have to combat first to make a difference. So what I'm doing is I'm going deep. I'm deep down to the bone, and I'm starting lower, and I'm moving up to the clavicle and then releasing. Everybody should start here first. So you'll bring your skincare down to the clavicle and below to the chest and bring that chest up, right?
Yes.
Next.
Feels good too, Nikki. It feels so good to do that.
I mean, how many women as they age feel insecure about their chest?
Oh, yeah.
And then all of them, right? And then the neck. So next, we have to move up to the neck. And so we'll hold at the neck, and then we're going to wrap our teeth with our lips. Actually, we're going to bring our bottom lip over our top lip and lift up. And that's addressing the neck. And you can do that. You can hold for 10 seconds and repeat that 3 times. Then also to deal with the neck, we can hold just underneath the ears and take our thumbs and lightly go where the thyroid is lightly, and then heavily pick up after that and go to the chin. So now we can work on the front of the neck. And you can repeat that about 6 to 10 times. Then to work on the sternocleidomastoid muscle, key muscle, because this rotates the head, it extends the head, it tilts the head. If this muscle is tight from forward head posture, we need to work on it. So we take our index finger and our thumb, and we hold at the top. You can see how I'm holding it there. And you just go back and forth, up and down, and then move down about a third, back and forth. And then you can repeat this on the other side, but we'll go all the way down to the bottom here. And why am I focusing on the sternocleidomastoid muscle? Because we have our carotid arteries feeding our face. We have our lymphatics coming down through this area and depositing right here at our terminus. So if this area is not open, then we are not getting the best circulation, and we're not getting the best drainage of the face. So we can get puffiness in the face. We can have less cell turnover. So yes, while we want to address massaging in the face, we really need to address the root cause of what can cause aging: fascial tightness, lymphatic drainage, and circulation, because we want good oxygenation, nutrient delivery, and hydration, and then getting rid of that toxic environment that the lymphatic usually clears. So we start with the neck, and then we can move up the face. If we have more time, I can show you some of those things too. The lips, right? So Dr. Katie's exercise with the beauty balloon tool. Creating an O into here.
I'll explain what she's done. So she's taken the original triangle. Oh, great, Maria, look at that. So she's taken the base, tucked it up underneath the upper lip and the apex below the lower lip. And we know the orbicularis oris is a round muscle. So we really want to be able to contract it symmetrically. Perioral area, the perioral area is so difficult to rejuvenate from an aesthetic standpoint. We know the lip seal strength is so important for a closed mouth position to promote nasal breathing. So we really want to have a strong lip seal strength. And this is a great way to do that. And you can just say, oh, so you put it in and you can say, oh, and that helps you contract those deep muscle fibers of the orbicularis oris. So it's just so simple. And the other one that you can do too is with the butterfly. I can put it like this.
Okay.
Yep. Just like she's doing, just like Nikki's showing, where she's got the base for the lip.
Oh, you're doing that one. Okay.
I know there's so many to do, but look at this one, Maria, actually where you take it and you put the base, tuck the base up under the upper lip, tuck the other base below the lower lip, just like this. And I always say, whenever you enter the oral cavity, grab it by the attachment site and just rotate it in. It's a very elegant in, elegant out of the mouth. There's no need to struggle. Then you put the base up here, just where we had the original triangle, and the other base below the lower lip tucked in. And then O. 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 And again, that's working that good lip seal strength. From the aesthetic end, think what we're doing. We are building up the muscle. We are building up symmetry, balance, hypertrophy, a healthy hypertrophy. We're bringing in blood supply to the lips. So we're not going to have those chapped lips anymore. And color, right? When you bring the blood supply in, you bring back more natural, pretty color, which is what we all want to do. I know.
Absolutely.
Yeah. And I find doing that, it helps. I love wearing lipstick. I had a period of time where I didn't bother to wear lipstick. And now I really like the way that my lipstick goes on. And that's
nice. Yeah, because all this form follow the function. So if you establish a good function, good muscle, good muscle base, then the form will look great. And it's applied to both to males and females. I really appreciate both of your knowledge, and my audience can follow you on the social media. We're going to put links underneath, and we can, you're bringing so much to the area of myofunctional therapy, which I think can help a lot of people who don't have a good sleep, who have a sleep apnea, who have racing thoughts due to the mouth breathing. I think, the practical knowledge you share with us, I really appreciate. So thank you very much, Nikki and Dr. Kennedy, and we're looking forward to learn more from you through your social media channels.
Thank you so much.
Thank you, Maria.
It's a pleasure to be here. Yes.
So fun.
Thank you so much.